I'm here with my friend Renee. She's an esthetician and she's going to talk to us about dermaplaning.
Hi, I'm Renee Manos. What we're going to do today is dermaplane Kate's skin. And so what that is using a stainless steel scalpel blade to exfoliate the skin. And what we do is we scrape off the dead skin cells, and that just leaves her skin with a more luminescent glow. And it also allows other products to penetrate better. At the same time, it's going to remove vellus hair, so her makeup is going to go on smoother. So let's get started. First, we're going to start the procedure cleansing her skin to get all of her makeup and oils off of her skin. It helps to use a gel cleanser that removes and breaks up all of the oil and makeup.
And it feels really nice too.
We're going to leave your eye makeup on.
Okay.
Now, when dermaplaning for women, you can dermaplane the entire face. Few people who are not candidates for dermaplaning would be someone who has active acne or a lot of moles on the face. And if they just have a couple of moles, that's fine. We just have to go around them. Same with acne, but if it's a big breakout of acne, then that would be someone that we would not find as a candidate for dermaplaning. Another person who's not a candidate for dermaplaning would be someone who's on diabetes medication, or someone who's on cancer medication, because it thins out the skin too much. And that's what we're trying to do, is exfoliate the skin so we can get some of those upper layers thinned off. So if the skin's already thin, that's not going to be a benefit to them. Someone who's on Accutane, acne medication, is also thinning out the skin, so they would not be a candidate. Someone who's using a lot of retin A or retinol on a regular basis, rather than just a couple of times a week.
How long do you want people to stop retin A before they come in for this?
If they could stop it a week prior, that would be great. But we could, I have clients who use retinol on a regular basis, and I can still dermaplane them, but I know their skin. Dermaplaning is also a great treatment to do right before we do a chemical peel on the skin, because if we get all of that vellus hair off, then when the skin starts to peel, it will shed better than getting caught up in a lot of the hair when the flakes start to come off. So the next thing we want to do is we want to degrease her skin. We've already removed a lot of the oil and makeup from her skin, but we want to go over it one more time, this time with, there are different solutions you can use. I'm going to use a medical grade alcohol, and I like to use a little fan so that they don't choke on the fumes. Okay, so now we're going to start. We're using a number 14 blade. Make sure it's getting it all on.
This doesn't hurt at all.
Now you might be able to see, I'm not sure if you can on the camera or not, you can see the vellus hair, and then some of the little darker you see on there is just dead skin cells, kind of the white powdery. Now she has some little moles over here, but they're flat, so we're not taking a chance on shaving any of those off.
So I don't have any Retin-A at home, but if I did and I wanted to start using it, is it okay to use it after we do this?
Not on the same night, and that's only because it would be a little more irritating to use it right after we've dermaplaned your skin. But you know, the next couple of nights you could certainly start using it.
Okay.
Our body's a wonderful thing. It starts to recreate and heal itself and create more skin cells pretty quickly. Now Kate here takes care of her skin really well, so you don't see a whole lot of dry dead skin cells coming up. I mean, you do see them. Kind of.
What are some of the things that you recommend for people to do?
On the glove there.
Yeah, what do you recommend people do just as like general maintenance for their face for that?
So there's a lot of different ways to be exfoliating your skin. Again, using a retinol, you know, periodically, a couple times a week, using a scrub on your face, using an enzyme type mask. So the enzymes kind of eat up some of that dead surface skin. Doing the occasional chemical peels, and your chemical peel doesn't have to be a deep one where you're shedding for a whole week. You can do lighter ones, so you're doing it just on a slow skin cell turnover.
And when would you recommend doing a peel if we've already done this?
Well, I can do this as a prep for a peel, so you can do a peel right after I do a prep on the skin for this. Now, if I were going to be doing a peel on you, I would go lighter on my dermaplaning and just mostly get some of the peach fuzz off.
Okay.
And I'm going light enough on you because you're already really well exfoliated that if you wanted to do a peel today, we could do that.
Okay. Maybe we should. I'm working in the office all week.
We can.
And how often can you dermaplane? How often would you recommend?
Every 3 to 4 weeks.
Okay, and that'll be like good for your makeup, and that's like good regular maintenance. How often is too often?
You wouldn't want to do before 3 weeks of
Okay.
your last dermaplane.
Okay.
Okay, I'm going to have you bite your lip for me. Now I like to get up right up on that lip line so we can exfoliate that area, that way you don't have lipstick bleeding in that area.
I have a problem with that, so I appreciate that.
Let's get you to open your mouth for me. Now I remember with Kate, because her skin is very sensitive, that to go lighter around her mouth. Not everyone has the same skin thickness. Go ahead, because sometimes we can take a lot of extra off, which isn't bad, except that, you know, it just might be a little irritating to the client. And then I'm just going to get right on top here. Okay.
Oh, I haven't had my brows done in like 2 months.
I'll just clean them up in the middle there. And then right over here. Okay. So now, as a follow-up, a dermaplaning treatment could include just cleansing, dermaplaning the skin like we just did, and then just call it a day, apply sunscreen, moisturizer, maybe a serum, and have your client on their way. Or what I like to do, and it's very rare if any time that I do that, I always like to apply an enzyme mask right after I'm finished dermaplaning to just dissolve any residual skin cells that I might have missed. That just gives her a healthier glow, and then I'll always pick a enzyme mask that is appropriate for their skin. So in Kate's case, I would pick a flower enzyme that's more gentle. If I had someone who does get a lot of breakouts or has very oily skin, they get a lot of blackheads, that sort of thing, then I would choose one that has a salicylic acid to help kill some of the bacteria on their skin. I like to use Glow Therapeutics. I'm using a flower enzyme.
What kind of flower is it?
Hibiscus flower extract, and it has pumpkin extracts in it.
Oh, the brush always feels so good.
So I'll continue applying this to the rest of Kate's face. We'll leave it on for about 5 to 7 minutes. If I were using an enzyme mask that had acids in it like salicylic or lactic, I would give her a fan to hold on her face just for more comfort.
It really helps. We've done it before.